Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In this episode, we discuss the effects of healthcare workers' mental health during the pandemic. Our goal is always to inform and start conversation.
The International Council of Nurses is emphasizing the increase of anxiety and stress for nurses during the COVID-19 crisis in countries around the entire world. Healthcare providers are at high risk for what's called a full-blown stress response syndrome. And that includes anxiety, depression, post-traumatic stress disorder, chronic illness, and burnout. And that is according to the International Council of Nurses. We find it very important to keep talking about this subject, specifically nurses and mental health, to make sure that not only are we taking care of ourselves, but taking care of one another as well.
Of course, it's the thing that we do is statistics, and I just can't help myself. More nurses are experiencing depression and anxiety caused by their jobs. Depression affects 9% of everyday citizens, but 18% of nurses experience symptoms of depression. Another study found the rate of depression in nurses at about 41%. There's limited data on this, accounting for worldwide, discrepancies. A recent study of U.S. physicians found 46% of the respondents had at least one symptom of burnout, and since the pandemic started, that number could be much higher than we thought. The study in China regarding healthcare workers found that 50% showed signs of depression, 45% reported anxiety, and 72% had some form of psychological distress. Like healthcare workers, these other frontline workers struggle to leave the traumas of their jobs behind as they come home and try to go to sleep at night. Their jobs are very demanding and emotionally draining. We're going through PPE and equipment, scarcity and crisis of the scarcity, and taking that home to our lives, worrying, about how to keep our family safe. That also takes a toll and can cause, tension at the home, in your home.
It really does. I couldn't imagine being in a situation where I was directly, knowingly working with a COVID patient and knowing I did not have the proper protection and then going home to my children.
Well, I remember seeing when it first started on the news, you would see where, nurses, physicians who are working the COVID units purposely would separate themselves for however long they were working, plus whatever they thought the quarantine time would be before they would even go home and see their family.
Right. But now that we're months into this, I think we're 6 months in for the United States, they can't just never see their family.
Yeah.
That stress of the pandemic on top of not seeing your family, that's awful.
I couldn't imagine. I couldn't imagine going 6 months and not seeing, my husband or my son or my daughter.
No. There are a couple of big topics that we want to touch on. Anxiety is one of them. Healthcare workers report a higher level of stress and anxiety, which leads to fatigue and also lowers their feelings of control over their lives. This just goes to show you when you're stressed at work all day long and then you just take that home. And then if you have problems at home because you're taking your stressors home, then it just perpetuates this bad cycle.
Yeah, it just builds on top of each other.
And the burnout rate for nurses is just skyrocketing. It is at a point to where nearly 30% of graduates leave their profession within 2 years.
That's crazy to me.
That's why we have shortages.
4 years, some of us spend 4 years in college trying to become a nurse. Your whole goal and aspiration is to take care of someone, to help other people. And then after 2 years, you're burnt out to the point where you're like, I have to leave this job. Like, I can't do this anymore.
2 years of being exposed to suffering and death, unreasonable demands, not just from the facilities, but from patients and families as well. And then to put another thing on top of that, that doesn't even scratch the surface of like all the ethical issues, like when you're dealing with families directly, especially if you're in a hospital setting.
I can imagine that, especially since the beginning of this pandemic, how difficult it's been. And I can imagine, patients' families being extremely irate,
Yeah, absolutely.
you
And
know.
just I hear all the time that somebody's in the hospital and they're sick and the mistress is there and then the wife shows up.
Oh, wow.
And that's a pretty
That's gotta be
common occurrence. It
that's dicey.
And I'm like, could you imagine being the nurse and be like walking into that and be like, hello, hey.
Yeah, no, that would totally be an awkward moment for sure. Not in
So,
my house.
and that's probably one of the nicer kind of ethical situations to have. I mean, that's
Yeah.
not even like neglect kind of issues
Well, no,
or,
because it's up to the patient. So if the patient puts his mistress on HIPAA and not his wife, I mean, what can you do?
he might want to,
He might not have a wife, but I can see where that's probably happened a time or two.
yeah.
Not to me, thank God.
No, yeah, that would be a bad day.
On top of, all the mental health nurses and healthcare workers go through, once you start piling on the anxiety and the burnout, it can lead to depression. And recent studies of medical workers, working in the pandemic and through the pandemic in China and Canada and Italy, who were treating COVID-19 patients showed soaring rates of anxiety and depression, which also leads and led to, in this case, insomnia. Because at that point, you can't take your mind off of the panic. Then you have to go back to the same situation day after day after day. So at that point, it's keeping you up at night, which is a bad combination.
It really is. And I see this taking a toll on our doctors that we work with.
Mm-hmm.
I was talking to one this morning who was on all night last night and was dealing with a very sick, actively dying COVID patient. And you could hear it in his voice.
It's gotta be. It's just I can't imagine the amount of stress and emotional toll on the family, the patient, the physician, the nurse. I couldn't imagine because I'm that type of person that takes things home, unfortunately. Nurses are also known to be at high risk. They face many of the same stressors as doctors. They have heavy workloads, work family conflicts. Sometimes they have lack of social support and frequent exposure to the same illnesses and sufferings that, the physicians are being exposed to. I know we've talked about this before, but, a lot of times nurses spend a lot more time with the patients than the physicians do. So you can only imagine the amount of stress that they're carrying around with them. The study also found that the healthcare group averaged a depressive symptom score that would qualify as clinical depression and approximately 30% higher than the depressive symptoms scored for a control group. You don't expect to see an entire workforce score like that on a depression diagnostic tool.
No. And how many of those are probably not treated? I would say most of them.
Well, we talk about this all the time, the stigma between and about mental health. That's one of the reasons why we're doing this episode, because healthcare workers tend to be the ones that feel stigmatized by trying to reach out, by trying to seek help.
There's so much irony in that.
It is, because as a nurse, you know that it's the right thing to do, but then you don't want to be judged for doing the right thing.
Exactly. One of the things that I think is going to be at the forefront once this settles down is PTSD. It's already happening, but I think when some people get off their adrenaline rush, it's really going to hit hard. So we know that healthcare workers have worked extremely long hours in high pressure environments while being exposed to COVID, trauma. They're faced with moral dilemmas. They're trying to constantly meet different challenges and changes, trying to deliver the best care that they possibly can, despite the fact that they do not have PPE or in a career that we know is completely understaffed.
Absolutely. Ever since I've been a nurse, there's always been a nursing shortage.
Right. And during this pandemic, changes are likely to increase the risk of mental health disorders, such as PTSD, because you're being constantly exposed to
the same trauma over and over again.
Scientific literature on the psychological consequences of exposure to trauma shows 2 different risk factors, and they're directly related to the trauma. One is the death of a family member or coworker, and the second is a crisis or a relationship difficulty. You add those things into...
It's like the perfect storm.
Yeah.
The good news is that healthcare managers can very strongly influence a healthcare worker's experience of being supported and their exposure to workplace pressures during the post-crisis period. Evidence suggests that protecting the mental health of your workers requires consideration of 6 key elements. Appropriate acknowledgement. Pretty much saying, hey, we know your job is extremely difficult, validating the facts that they're dealing through a pandemic and a crisis. And, you need to foster resilience.
Yes.
Let them know, that you're supportive of them. It's imperative that staff who do not turn up to work are contacted in case their non-attendance is indicative of poor mental health. We've all heard each other kind of joke around and say, oh, I need a mental health day, or, I might, not show up. I need a mental health day tomorrow. Well, it's an actual thing. People really do need time
that break.
To decompress and take a mental health day. So if you have a coworker that's like a no-show or no call or just didn't show up to work, a simple text to reach out and say, hey, are you okay? How are you feeling? Do you need anything? Just to make sure that they really are okay.
Mm-hmm.
As the pandemic begins to recede, all healthcare workers should receive return to normal work interviews. These should happen as staff begin to transition from the crisis response roles back into the new norm, and should be conducted by supervisors who, by virtue of experience and training. So it shouldn't be done by your HR person if your HR person is not like a qualified licensed counselor who can help you deal with the stress and anxiety.
Well, the only person the HR person should be talking to is maybe another HR person who understands the role and the stress that they were just going through.
Absolutely.
Because honestly, if you come to me and you don't understand what I do as a nurse, I'm going to look at you and be like, are you kidding me? You have no idea.
Apples to oranges.
Yeah. And it's not saying that what they do isn't hard and stressful, but there's no way for us to really understand each other.
Yeah, it's not the same degree of work. So if you have someone in human resources trying to sit down and, I guess, what is the word?
Empathize,
but the military do it when they come back from war and trauma. They kind of are sequestered and they go through a counseling session, a debriefing session.
And a lot of them have a person that they can reach out to.
And a counselor that they talk to. And for some reason, the word is just completely left my head. But this is the same type of situation for a lot of people that were in the hot spots of COVID-19 who saw death every single day, multiple deaths at a time,
Or who took care of a patient for a really long time and that patient ended up dying.
Absolutely. Death, period, can be traumatic. Loss, period, can be traumatic. So managers should pay particular attention to the healthcare workers in high-risk groups, such as those with a AME background and junior or inexperienced staff who have been working above their expected level of competence.
I feel awful for new nurses right now.
Honestly, they've been thrown into like the jungle and are left to fend for themselves because we're experienced nurses and we really never saw this coming. Of course, we knew it could, but I don't think we thought about it at the degree and level that it really has happened.
I think that we all realize that we could have a pandemic, yes. But I never would have thought that in 2020, I would have to reuse my N95 mask.
Yeah, that we were so ill prepared for something that we had learned from previous experiences. I thought we would have had our shit together.
Amen.
So, particular attention should be paid to staff who, during the crisis, have worked far beyond their usual role. For instance, an outpatient nurse who may have been required to care for a ventilated patient during the crisis. And I think a lot of nurses that this has happened to. Let's say, you were a surgical nurse and during the beginning of this pandemic, like all the surgeries, unless they were, life altering, were postponed. So now you're like the surgical nurse and they're short to handle COVID patients in the ICU. So now you went from being a surgical nurse to having to be like a pulmonary ICU nurse. And if you've never worked in that area before, you have like no expertise in it. Yeah, you might have learned a little blurps here and there in school, but
you have to relearn that whole process.
Absolutely.
Yeah, you become very specific to what you do. And the nice thing about nursing is we can shift gears and we have the capacity to learn and understand because of the way that we're taught.
Mm-hmm.
However, that needs to be done over time. Not like, oh, yeah, sorry, here's a vent patient. And I'm sure that they tried their best to avoid that, but I mean, I heard rumor, and I do not know if this is true, of physicians like rheumatologists managing vents in other countries because there was no other physicians to do it.
And I'm sure that's been this case. I feel like a lot of doctors, nurses, paramedics, everybody has had to learn and sometimes maybe even practice like a little outside of their scope.
Yep.
Anyone who has been exposed to a potentially traumatic event, they need to be monitored. They need to be actively monitored, not just monitored. I mean, somebody needs to be checking up on them consistently,
there
making
needs to
sure
be
that
a
they're
whole
okay.
Checks and balances put in place.
So there's a process called Schwartz rounds. And it's a structured forum in which staff can discuss emotional and social aspects of work. And this has been shown to help staff communicate better in healthcare settings. I feel like all healthcare settings should kind of be fostering this type of communication.
Well, I'm huge on communication, and Rosa, I know that you know that without a doubt. I'm very much I don't understand why we're not communicating this when we have this thing called email that you can send one email and it goes out to all these people and then everybody's aware. It's amazing what happens with it.
And if it doesn't pertain to you,
delete it.
There's a delete button.
Yeah. I mean, when I send out emails,
imagine that.
I push it to everybody. And I've had so many people say, I'm glad you actually sent me that because I actually need to know that because of XYZ. And I was like, oh, well, I didn't know that. Well, but then again, I don't do your job.
Absolutely.
So hence why I send it to everybody. Yeah. If it doesn't pertain to you, delete it.
Just
It won't hurt my feelings. I won't even know you deleted it.
There you go. So a small 1996 study of 30 nurses and 60 nursing students showed that nurses who had less emotional expression were at an increased risk of depression, which could lead to suicidal ideation.
I could so see this. This
Yeah.
makes complete sense to me.
Well,
Like people who bottle it up.
yeah, like they're starting to shut off, like shut down.
Mm-hmm.
Yeah. Nurses were substantially more likely than others to take their own lives. The research pointed to three factors that were more common among nurses than in others committing suicide.
So nurses who commit suicide were more prone to leave suicidal notes, have a mental health history, and have job problems.
One study found that among surgeons with recent suicidal ideation, 60% were reluctant to seek medical health care because of concerns it could affect their licensure to practice. And physicians and nurses are 2 to 3 times more likely to actually complete suicide than the rest of the general population. And female physicians, especially at risk, 400 physicians commit suicide each year. I want to talk about that because these numbers are super high.
They
and
really are.
super surprising to me. And, when I was doing the research, I mean, 400 doctors a year commit
That's more than one a
suicide.
day.
Yeah, that's crazy to me. And it's all because, they feel like they can't seek mental health because it's going to affect their licensing, their job, whether other people will feel like they're fit to practice medicine. There's something wrong with that.
Absolutely. It's the stigma that we need to get rid of. And I think that healthcare workers try their best to get rid of stigmas for other mental health care workers, but we never take that time to sit and reflect on our own
mental health. Yeah.
And so I just want people to understand that just because you have depression and you need to be on medication, it doesn't mean that there's something wrong with you. Like, oh, I don't have a reason to be depressed, so I shouldn't be depressed. That mentality is dated.
Absolutely. That's so 1940s.
It really is. There was an article that I actually read, and it was about two medical workers on the front lines of COVID in New York. And they both took their own lives. One was Dr. Lorna Breen, and the other was John Mondello, and he was an EMS provider. Dr. Laura Breen was an ER doctor. She was actually the medical director, and she took her life at age 49.
Too soon.
And she was never thought as somebody that would actually take her own life, according to her father, who is also a physician. He was just floored that she would be the one to commit suicide of all the people that he knew and of his other children.
And this happened never during saw it the coming. Pandemic. Yes.
It did. And John Mondello, who was an EMS, he took his own life only 3 months into his career. He was 23.
Way too soon.
So on a new job, 3 months in, and he just couldn't take it. That's goes to show you the impact that your job can have. And the stress and the psychological toll of COVID is a real factor that needs to be considered. Understaffing was a problem at most medical facilities before COVID. And with the COVID and the pandemic, it's exacerbated. So we need to remember that. And sometimes say, hey, I'm sorry that you didn't get that sandwich 15 minutes ago. But
no, I agree with that. I think since this whole pandemic started, I understand the anxiety behind it.
Mm-hmm.
Even as a nurse, when it first rolled out, all of us were anxious and nervous.
Yes.
But the patients that come into the office, even to this day, I mean, it's reflected their anxiety. They are short. They are sometimes rude. They've been more disrespectful. They're yelling at staff. They're cursing, which was few and far between before, but has now seemed to be, kind of common since COVID. And the only thing I can keep relating it back to is the anxiety over the whole pandemic.
Right. And it's not an excuse.
It's not an excuse to not be a nice person.
No.
But as nurses, I think we have to show some compassion and say, hey, I understand we're all stressed out, but maybe we can verbalize that differently.
Oh,
Because I've had to
absolutely.
say that to a few of my patients.
Absolutely. And another thing that I thought to be interesting about kind of a different way of thinking
Hmm.
for COVID and nursing is there was a licensed psychologist. Her name is Dr. Shauna Springer. She is a trauma recovery expert, which is going to be probably well needed here once
Absolutely.
this settles down. Her fear was that we should not be calling healthcare workers heroes because that comes with an invisible pressure to make things happen that are not possible.
Yeah, like an expectation that's just not, you can't meet it.
I've seen so many of the heroes and, the little Pinterest things that have, all the superheroes bowing down to the nurse that's walking through. And it irritates me because those nurses did that same job
Before the
before
pandemic,
COVID.
I so totally agree. We were doing this so before the pandemic because remember, COVID's not the only coronavirus.
No,
There was MERS and SARS, and honestly, isn't the common cold a form of a coronavirus? So
it
we've been
is.
dealing with other things besides, COVID-19 this whole entire time. I think this just makes everybody realize that we were underappreciated before.
And I'll agree 1,000% with the fact that we're underappreciated. Most of us are underpaid,
I amen that.
and that there needs to be a change in the system.
Amen.
However, calling us heroes and giving us pizza is not fixing the problem.
Not at all.
I'm just
I'm going to
saying,
tell you, you can keep your pizza because it's not doing me anything.
I mean, you come in and bring donuts, and I'm sorry that you're half staffed today. Well,
I would
do you?
rather have a staff member than the
I'm
donuts.
like opening the box and like, is there another nurse in there?
Yeah, exactly. Yeah, coffee's nice, but a person would be better,
Yeah, I mean, I can get my own coffee. I mean,
Yeah.
I'm appreciative that anything was done because I know there are some people that
Don't
don't
do
have.
anything at all. Yeah.
Exactly. So I don't want to sound unappreciative because I am, but if I need,
To pick, I'd rather pick the help.
and I think most nurses
Yeah,
would.
I agree. So, as nurses, our mental health and our physical health is extremely important. And people first need to feel protected physically. It's like on Maslow's hierarchy of needs.
Yep.
And staff will not be able to cope with psychological challenges of their jobs if they don't feel physically safe.
No.
So when they're working in the middle of this pandemic that is extremely contagious and they don't have the proper PPE, how can they have any sense of safety?
There isn't one, which is probably one of the reasons why many countries have already set up helplines for medical staff to call for the support because they know that they need somebody to talk to because of the stress for that. It's a nice start, but it does not need to be the end.
No, that's just the beginning. That should be the start of it. Absolutely. Staff should be supported by mental health care professionals available for calls and other forms of early support who can check on staff's well-being regularly. There has to be straight, clear, and honest communication from the top all the way to the bottom because that's always been an issue even before COVID.
Yep.
During COVID, it's still an issue, and I'm sure it's going to be an issue even after. So we've got to step up our game here,
Absolutely.
from the top to the bottom.
Most people are okay with you making a mistake if you say, I made a mistake. I'm sorry. This is how we're going to fix it. It just, I don't know, it seems to go over easy. And so when people try to, what I say, beat around the bush about an issue and then try to cover stuff up, that is not any kind of straight, clear, honest communication. So
Not at all.
just to clarify, it's not, these are your orders. It goes beyond, oh, you know who your patient is, you know who you need to take care of it. It goes beyond that.
Yeah, absolutely. Other facilities and places have started allocating a room each day where your workers can go and they can communicate with each other, share their worries. They can, vocalize it out loud. Shoot, if you have to cry, you can cry. And if you need to shout or scream, you can do that, or you can just sit there quietly and reflect. So on top of, this hotline that you can call and communicate with someone, you should also be able to have that space in which you can decompress as well. It's just so needed. And especially in an era where COVID has made us leap into technology,
Yes.
even if we weren't we were already, I feel, technologically advanced, but now it's just, in healthcare in general, it's pushed us all the way into it.
I think some of us were ready. I think this is so stereotyping, but I think the younger generations were like, okay, well, let's go. Let's click some buttons, see what happens. But
they've been clicking all their life. So.
Exactly. Some of the other people like, I don't want to. I'm like, honey, a right click will open up your world.
It's called the internet. Like, ooh. But the good part of that is, the best part of that is, during this whole COVID situation, you didn't even really have to leave your house. Like,
that is true.
Telemed appointments. They have apps now for counseling. Literally, you just download it from your app store and you could have a digital therapeutic medical support staff, helping you deal with your trauma. But that's not enough. Like, the digital thing is,
it's nice especially for people who maybe are introverted.
ESP.
There it goes. It would be really helpful, and it may be a good stepping stone for them to get some good human-to-human interaction.
Yes, especially if you are, unfortunately, one that's been quarantined and quarantining, and you can't, reach out to your family. FaceTime has really been a blessing for a lot of people, because, that's how I've checked up on a lot of my family, is through, FaceTime.
Yep.
Even with that being said, there's nothing better than actual human support, just human contact.
And there was a nice system that you actually found, check you, check two.
Yeah, it was actually a workplace that kind of put it into place, where, let's say you're one person and you have two people that you check in on, and then another coworker has another two people that they would check in on. So it was like a buddy system to make sure your coworkers were okay.
Right.
And it seemed to work. And I'm all for whatever works.
I feel like we actually
we do that
have
now.
This system naturally that we've kind of evolved. I know somebody yesterday had a bad day and I checked on her last night. Just, are you okay? And do you feel better? And she did. But I think it means a lot that you took the time
to reach out, even to say, hey, is everything okay? Can I do something for you?
Absolutely.
Yeah. There's nothing better than having coworkers who actually are your work family, because, you spend honestly just as much time with your coworkers,
if not more.
Yes. Waking hours, than with your family.
Absolutely.
So, makes life a lot easier. And I feel like we've kind of, in our workplace, have created that environment.
Yes, absolutely. As always, we will link our references and our show notes to our website, thenursingpostpodcast.com. We would love for you to join in on the conversation. Of course, you can leave your comments on social media. You can subscribe to our podcast to be notified of any upcoming episodes. And again, thank you for listening to the Nursing Post.